Hello, everybody. Um, Welcome to Ask the Doctor. Thanks, everybody, for coming. I'm Angel Grant. I co-founded Death Over Dinner, and I'm the head of content here at EOL. And our guest today is Lucy Kalanithi. And Lucy is a clinical associate professor of medicine at Stanford University and an advocate for cultural change around healthcare value. She's the widow of Dr. Paul Kalanithi, the author of the #1 New York Times best-selling memoir, When Breath Becomes Air, which, by the way, when it came out, I started reading it in a Barnes and Noble, like standing there when I opened it, and then sat down against the wall and cried in the first 5 minutes in the best way. I was just like, this is so good. And to that point, it was nominated for the Pulitzer Prize and translated into more than 40 languages. And Lucy wrote the epilogue for this beautiful book. She's a graduate of the Yale School of Medicine, the University of California, San Francisco's internal medicine residency, and a postdoctoral fellowship at Stanford's Clinical Excellence Research Center. She's also a fellow of the American College of Physicians and a member of Alpha Omega Alpha National Medical Honor Society, and an honoree of Mass General Cancer Center's B100. TED Med, if you haven't seen her TED Talk, go to it. She's just like, aside from all of these amazing accomplishments, a lovely human being, which you will soon see. So thank you, Lucy. And what do you say we just dive right in?
Sounds great.
Okay, awesome. So several pieces have been written in recent years suggesting that doctors don't die in the same ways they prescribe. It's been said that they don't use as many interventions, and we of course can't group all doctors into one, but generally speaking, do you find this to be true?
This is a great question. So the answer is I don't know. Not sure anybody knows, but there's like a couple interesting points to this question, obviously. So there was this famous article about 10 years ago by Dr. Ken Murray. It was called something like How Doctors Die. And he
Yes.
talked about that and said, exactly what you said. Doctors don't use as many interventions. They're more aware of the costs, like all different kinds of costs of
Not just financial,
like
right?
significant, not just financial. I mean, like physical, spiritual,
Yes.
traumatic, etc. Of end of life care that involves these intensive interventions, whether it's being on a ventilator, is sort of the primary one people think about, or undergoing CPR. And so when you survey doctors, they say, I don't want to use a lot of interventions. And they say that more than other people. And then doctors also, when you survey them, do understand certain things that not everybody else has as much insight into, like cardiopulmonary resuscitation is only helpful in certain situations, particularly certain heart issues, but not so much at the end of life in cancer, for example. And so, and then physicians, if you survey them about chemotherapy in stage 4 cancer, physicians know that that's not curative. In stage 4 cancer, it's not meant to cure. Although, as a side note, that's changing with things like immunotherapy and targeted therapies. But overall, doctors can say, like, pretty accurately what outcomes are. However, there was a big study. I don't know if you've seen this. It came out in 2016, where they looked at 200,000 people on fee-for-service Medicare and looked at how they died and split it by doctors and not doctors. And
I haven't heard this.
yeah, isn't this interesting? It was in the
Yes.
Journal of the American Geriatric Society, I think. And it turns out that there wasn't a difference across a ton of different aspects. And so the median age was 85, and 90% of the people were white men. So it's like a different generation of doctors, right? And so this actually might be different now.
Sure.
Because so much about medical education and healthcare is focused on quality of life and people's values and not just like fixing problems, right? So culturally, things are changing all over the place, slowly but surely. But it turned out that half of people were in the ICU in the last year that they were alive, and a similar number of people used hospice or not. and that was like around half the people. And
Mm,
then doctors use hospice for 2 days more on average, and that was significant.
mm,
Um, but anyway, that was kind of interesting to see, right? Is that I think, and then what the authors wrote in that article was, we were really surprised by these findings. We weren't expecting it. And then they said, we wonder whether the overall healthcare culture and the way that hospitals and healthcare are set up is so priming people, and so much of the force is behind interventions and technology and less time for these important conversations. And so they said, like, what if the healthcare mechanism is like pushing everybody in a certain direction? And so I think that's really interesting. And at the same time, I sort of think those measures are weird, right? Like whether or not you were in the hospital or whether or not you were in the ICU, like that seems like a good measure. But I guess I'll just mention, so my late husband, who talked about, who was a neurosurgeon, doctor, obviously, and wrote When Breath Becomes Air, died when he was 37. Um, that was 7 years ago. Um, and he died in ICU, but ultimately decided not to be intubated, not to go on a ventilator, and said, I want to go home. And he was actually too unstable to go home, like
mhm,
really ill, obviously, and
mhm,
actively dying. But we were able to bring our baby daughter into the ICU. I tell her this story now and I say, they made a special rule. The nurses made a
mm,
special rule just for you because daddy wanted you. And so, um, I think that's what's called goal concordant care. So it's like,
mhm.
what's most important to you? And is the healthcare system making that happen for you and helping you have that? And so that measure of like, where were you when that happened, I think isn't the most important measure. And so I guess the question in my mind is like, how do people get that care that is surrounds what matters to them most?
Yes.
And do doctors get that more? Like maybe, maybe not. Um, I don't know. So I don't know the answer.
Yeah, that's so beautiful. I mean, the part about your daughter and telling your daughter that they made a special rule just for her.
I know. So fancy.
But, I think that too, when I birthed my son, I had an idea of how I wanted it. I mean, I knew how I wanted it to go, and I also knew that I had no idea how it would go. I was real clear.
Totally.
I knew that I didn't
Totally. Yeah, yeah.
have control,
Mhm.
but I
Mhm.
knew what was important to me. But going in, I feel like end of life and birthing are similar in many ways.
Mm.
And one of those
Yeah.
is like, we don't have a context for it. We don't have a frame of
Mhm.
reference before we arrive at it. And
Mhm.
so we can have uh, like you're saying, having a focus on what matters most
Mhm.
gives everybody a North Star. Because my birth
Totally.
went wildly
Right.
different than I had planned. And I've seen, end of life with people I love going wildly different
Mhm.
than they
Right.
would have wanted, but still having elements that mattered being
Right.
implemented.
Right.
So
Right. And it's
so I,
hard because it's like, it's just not going to be perfect. I mean,
yeah.
neither situation, right? Birth or dying, but like dying just, I mean, in my experience, it just is sad and it just is scary sometimes. And I think there just is no perfect. And I think that's really important too, because A, so much is out of your control, and B, you're making a lot of decisions with incomplete information anyway. Like when
Yes.
Paul was dying and decided not to be intubated, it's still, for even for two doctors, was like, is this really it? Like, is this definitely happening?
Mm,
Is there any, and I think it is so easy to look back and be like, I wish I did it this way,
mm,
or, and it's like, there just is no perfect, and everybody's doing their best, like all you can do is do your best with what you have at the time and what you were going through. And I actually remember Paul saying that to me because we were talking about it, like, this was really helpful for me. We were talking about, like, kind of talking about end of life stuff. Um, I mean, we were talking about end of life stuff, just like, even in the abstract, but also like, as it applied to his illness. And he could tell that I was worried. He's like, what if my parents are pushing for one thing and you're trying to push for another thing and you're trying to do your best by me, but it's like complicated, or I end up getting CPR and it seemed traumatic and you just never know. And he said, he's like, all you can do is do your best. And then he said, and anyway, the last day of your life is not the sum of your life. The sum of your
Mm,
life is the sum of your life, which was kind of cool, right? It's like there's sort of all this pressure for like,
it's big
and
time.
it's just like, it's just one day and you do your best and then you love each other and you always loved each other. And like it all adds up. It's not like the end is the whole story. And so I think that's important to remember too. Like,
What wisdom he had at 37.
isn't that so nice? Isn't that
Yes.
just like,
Yes, what a
yeah.
gift.
Yeah, totally.
Um, what insider tips can you share when it comes to preparing for end of life, given that it's something that we all need to do no matter what
Hmm.
our age or health?
Hmm. Yeah. Like insider tips being a doctor or just
Be a
like
doctor.
insider tips? Yeah, yeah. Um, it's a hard question. This is like not meant to be a cop out, but I feel I'll answer the real question. But I feel like as far as preparing for end of life, it's like the number one important advice has nothing to do with being a doctor, right? Like
Right.
I found poetry as helpful as anything, or like Paul talked about, Paul has a sentence in his book, which was like, it's not quite this, but he said he's like talking about going to look at Kaplan-Meier survival curves and like cracking medical textbooks to try to figure out like how am I supposed to face this, and then he ends up saying something like turning to like medical knowledge and statistics to try to cope with existential distress is like trying to quench a thirst with salty water. And
Oh,
so I feel like some of this is just like, how do you be a person? How do you figure out how to incorporate suffering into your life as like a feature, not a bug? How do you create a life that's meaningful? How do you figure out what your purpose is, even when your body is changing or your time
mm,
horizon is shorter? It's like, those are big philosophical questions that I don't think medicine or any doctor can answer, right? So I feel like that is maybe what's most so I think accessing palliative care or asking for a palliative care consultation or a palliative care team as part of your care um, is probably my number one tip. And
mhm,
obviously, that's a specialty team focus. They basically focus on quality of life and communication and
mhm,
parsing out how to proceed you know, when there's a lot of risks and benefits and difficulty in all the possible choices. They kind of tease out like what's going to fit you the best and then how to communicate that with your
and a lot
family
of
and with your
people
doctors.
I'm sorry. A lot of
Yeah.
people I've found are afraid of asking for palliative care
Yeah. Yeah.
because they feel like it's some kind of admittance that they're about to die any minute, and so they
Yeah. Yeah.
you
Yeah.
know?
Which is really interesting. And so I think that's kind of a misconception. Like,
Yes.
um, you know, I think there's just no giving up. Like, even when you're moving to hospice, right? That's not giving up. Yeah, so you were just talking about this idea of people being scared of palliative care. And I think part of it is it's conflated with hospice. So hospice is for people who are in the last 6 months of life and like can get certified by a doctor that that's what their prognosis is. Palliative care is for anybody who has either life-limiting illness or a serious illness, like someone who has Parkinson's or heart failure or is going through a bone marrow transplant and is
Mm,
young and totally expected to survive for a long time, but is struggling either with symptoms or with anxiety or existential distress or communication. And so you can be expected to live for a long time and not even have a terminal illness and still have a palliative care team. And so I think that's really important to know. Um,
yes.
and then sometimes people doctors say you're not ready or I don't think you need that. And that's really weird. That's sort of like a misconception and misunderstanding and even kind of like stigma in medicine. And
Mhm,
so for people who have metastatic cancer, like stage 4, the American Society of Clinical Oncology, which is like the oncologist specialty organization, their
mhm,
guidelines recommend palliative care for everyone with stage 4 cancer. again, even if their prognosis is really good. Um, and so it's way underused, and it is because of fear and like misinformation. Um,
Mhm.
but I would really encourage people to seek it out. And if somebody tells you you're not ready, just be like, yeah, no, that's,
It's what I
I want to talk
want.
to them and see.
Yes,
And
yes.
I know that this can go alongside all the other care, even when my plan is to be cured, etc. And they are just so helpful. They really listen, and they really help manage symptoms in like a very specialized kind of way. Um, that's better than anybody else. Yeah.
Um, well, that segues us into one of our other questions, and that is, what guidance can you give those who are or will navigate a terminal diagnosis in the context of relationship with their healthcare providers? Because it's so common for people to not speak up or voice questions or
Mhm.
concerns when they're in the room with a doctor. And I've had several people, like close family and close friends included, tell me at different times that they're unhappy with the dynamic with the doctor or with an oncologist, but they're afraid to discuss it. And they're also afraid to change doctors if it's like late in a prognosis.
Right. Like they already have this relationship. Yeah.
Hmm.
Um, yeah, I totally get that. There's a lot of different levels to that. I think for someone who's facing that, um, I guess I have some suggestions for a couple of things that people can try. One is oftentimes doctors are sort of scared to be honest, like they're scared that they're going to scare people, or they're so like the taboos that exist outside the hospital follow people into the hospital, And so sometimes it can just be helpful to tell your doctor, like, here's the kind of person I am. I like hearing all the information. Like, please feel free to tell me everything you can, or whatever it might be. And so I think like giving your permission to your doctor to be really straightforward. It sounds weird, but some doctors like are helped by that.
Hmm.
And then adding a palliative care team can be helpful because again, they are like a second opinion on everything, and they really center you and your quality of life, and they can reflect um, advice that they have back to your other doctor so that you don't have to be the one like responsible for figuring it all out. Um, and I get that idea of like, I saw Paul that do this with his own oncologist. Like he would tell her like, "Oh yeah, things are going pretty well," and it's like and I'd be like, "We haven't left the house like in a while," and you do kind of feel this idea of like you don't want to be difficult, or you kind of want to please them because you really need them to care about you and see you as a person, and so it's actually kind of like anxiety provoking, like to like get their attention. It's really hard, and so um, and it shouldn't be like that, but I understand that aspect of it too. Um, and like doctors aren't perfect, so they really care about it. Um, there's two books I would recommend that get at this issue. One is, can you hear me okay? I'm like so scared now. Okay,
Yeah.
so I'll put these in the chat too. So
Okay.
I like Life After the Diagnosis by Steve Pantalat.
Mm.
And he's a palliative care doctor. He talks about like when doctors say this, they might mean this, and it's like it's really helpful.
That's
And
amazing.
then there's another book for people who have cancer. There's one called Living with Cancer by Vicki Jackson, and um, she's a doctor in Boston, and same deal. She kind of talks like about how to leverage the healthcare system and make it work for you.
I think it's so important that based on what you just said, it's so important for everybody like to remember that doctors are humans, and that like
Yeah,
that that they're not just some superhuman, uh, like they get scared too of telling, like any human would, of being the one to say
right.
you're dying, like,
Right,
you know
right,
are they
which is
when
so
we built
crazy.
yeah, it's
Yeah,
crazy. When we
yeah,
built Death Over Dinner back in 2013 and we started working with some healthcare providers and things like this, I was shocked because so many doctors told me that they had had no training
Yeah.
on end of
That's
life
changing now,
discussion.
but totally.
Yeah,
Right.
and that's I've heard
Mhm.
that it's changing a lot now, which is
Mhm.
fantastic, but even,
Mhm.
that was 8 years ago, that doctors were
Right.
not being trained in end of life conversations ever in medical school, and it's
Right.
like, so
Right.
how, if you grew up in a home that where everybody was kind of repressing emotions and not talking about hard
Mhm.
stuff, then you have 0
Mhm.
training, 0 really skills, and then you carry that into being a highly skilled physician, but you don't have
Right.
that's like
Right.
just keeping in the context that your healthcare providers
Right.
are human beings who might struggle
Right,
with difficult
totally. And at
conversations
the
too.
same time, like, you're not responsible for how their day is going, right? And
Totally.
it's, like, reasonable to hold them to a high expectation, like, in life and
Totally.
death stakes, right? But yeah, you're right. There's, like, these big gaps. I agree.
Yeah. So the conversation that you and I had a few years ago was so valuable to me this year when my grandparents, who were like parents to me and like grandparents to my 3-year-old son, they both died suddenly from COVID. Um, can
Yeah,
you
wow, that's
share?
wild.
It was 12 and a half hours apart. It was really intense.
Wow.
But can you just share a little bit about how to talk to young children when the
Mm,
people we love the most die?
yeah. I'm so sorry for your loss. Um, yeah, so, you had sent me some prep questions, and one of them was this, and my daughter was like, "What are you working on, mama?" And I was like, "What do you think about this question? Like, do you think kids wanna know the whole truth? Do you think kids want parents to make something up? Like, what do you think is helpful?" And
Wait,
her
how old
answer
is she now?
actually, her
How old
first
is she?
she's 7, her
Okay.
first answer was like, "I want them to make something up." But I think what she was saying is like, "I like playing pretend." Like, of
Oh,
course, why wouldn't you make something up? Making something up is really fun. And which was kind of an interesting reminder of like, it's not like you're sitting a kid down to be like, "Here's how it is," and blah, blah. It's like, it can be sort of like a dynamic conversation that like meets them in whatever their deal is, right? Like sort of in their ego state,
mhm,
or it's just like, how does this make you feel? Should we punch a pillow? Like, what should we, you know what I mean? It's just like,
mhm,
I
yes.
feel like you can do it in your same regular voice and you also can say how you feel. Obviously,
Mhm,
it's not their job to support you, but I also think that's fine, or like nobody knows the answer to blah, blah,
mhm,
blah. Some people think this, some people think this.
mhm.
I don't know. And I think it's so hard, isn't it? And especially because there's so much like both um, there's two books I like that are kind of about like mortality for little kids.
Mhm,
And people could just read them anytime, or you could read it if your family's going through something. One is called Lifetimes, and it's
mhm.
just like a really simple picture book about how like bodies stop working, but then it's basically about animals and bugs. So it's like
Okay.
sometimes people die or sometimes creatures die because of an injury, and then there's like a squished bug, which like kids totally get, like, dead bee and stuff like that. It's like it's not spooky or anything. And I feel like that's a good book. And then there's another book called City Dog and Country Frog about
Mm,
like two animal friends where one of them dies, but it's sort of like around the seasons and it's really beautiful. And it'll like make the grown up cry, but then the kid like just likes it.
yeah,
And so those books are good. Um,
that's great.
I don't know. And actually a practical tip, child life specialists are very helpful with this, or obviously psychologists and palliative care
Sure.
doctors, but child life specialists have, and other books have a lot of like language tips. Like apparently the current way to describe it is his body stopped working, which sounds kind of
That's what
really
I
intense
say,
to
that's
me,
what I
but
say,
kids, yeah,
yay!
like kids can totally grok it. And it's like, he went to sleep and didn't wake up. That's like actually kind of scary. Like, could that happen to me? What happens if
And
I go
they're
to bed
afraid
and
to go to
like, don't wake
sleep.
up? But his body stopped working. Like, apparently it's working pretty well these days. And so
Yes.
those are just some random ideas.
And what I've found with my 3.5-year-old that because we've had not just my grandparents, but a lot of death in this last year and a half,
Ah, yeah,
those being the two most prominent ones. But
yeah.
so he, I've never, I've like sometimes I've cried in front of him and I'll just be like, it's okay.
Mhm,
Mommy's sad because I miss Nanny
mhm,
and Papa's bodies being here.
mhm,
And it's okay to be
mhm.
sad.
That's
And
a
he'll be
cute
like,
way to
oh,
say it.
okay.
Uh-huh.
But I
Yeah,
found that, yeah,
yeah.
that when I talk to him and I don't go all like heavy and I talk very
Right.
plain language about death, he
Yeah,
wants to talk about it.
plainly. Yeah,
Sometimes, yeah,
right,
out of the blue for
right.
me, he'll go,
Yeah.
"So your dad died," because my dad died like 17 years ago. And he's like,
Yeah,
"So your dad died," and it'll be like in the middle of the afternoon, and I'm like, "Yes,"
absolutely.
and
Yeah,
I'm like,
yeah,
"His body died,"
yeah.
and I'm like,
Mhm.
"But I can still feel him with me sometimes."
Mhm, mhm, right,
And
like
then
love doesn't
and
die.
he
Yeah.
goes he
Mhm.
goes, "Oh, like Nanny and Papa, I feel them," and I'm like,
Oh, how sweet. That's
"Fantastic."
cool. Yeah, yeah. I think that's right, and I think, oh, darn, I was gonna say one other thing. You said something plainly. Oh yeah, I've asked this question like if I'm giving a talk or a book event or something, and then I'll say like, if anyone was the kid whose parent died, like, can you come tell me what was helpful for you
Mhm.
or what wasn't helpful? They say the only thing that people really say is unhelpful is if you like take all the pictures away and never talk about it again. That's like the only way that you could like really cause an issue in terms of like what I've heard from people, and everything else like awkwardness or you crying or messing
Yeah,
up or
like, they
whatever
don't
is
want you to
fine.
pretend that they never
Mhm,
existed. It's like
mhm.
they're still a part of our
Yeah,
lives. Yeah.
yeah. And like
Oh,
counselors used to tell parents to do that, I think it's not even I think people used to think it was good to do that, but I don't think that's right.
mm-mm. Okay, so we're gonna take a couple of questions in our last couple of
Okay.
minutes. Okay with you?
Yeah. Yeah.
Okay, let me just glance over real quick and see. Um, okay, maybe the question is wanting to learn more to help with the older adults and caregivers dealing with dementia, and
Mm.
something about benefiting from a geropsychologist.
Yeah, I mean, if the question is just about supporting caregivers, I feel like so much of it is systemic. Like
Mhm.
people talk about how the population's getting older, so now there's all these caregivers. And I'm like, no, there's like immoral cost shifting onto caregivers. So now there's all these caregivers because it's a big deal. And I feel like people don't have enough help and in-home caregivers are underpaid or it's not covered. And families are doing all these medical nursing tasks and giving up income. And I just like it's super gendered. So I have lots of feelings about this. And I feel like it is mostly or much a systemic issue of like really not supporting families with paid leave and coverage for these things and all of that. Um, and so, but I do think the like personal care, self care, and what we can all do in community for each other is really important. Like recognizing caregivers, number one. And organizations like Archangels are doing that. And then supporting people's own psychological and health needs. And I think the oxygen mask thing really applies. Like taking care of caregivers is also taking care of patients.
Mhm. As a younger doctor, before your husband's diagnosis, were you as comfortable talking about end of life issues as you are now?
Yeah. Probably wouldn't say as comfortable. I guess a little bit different. Like I was learn now in med school, we're learning the language to be able to talk about end of life issues and
Mhm.
elicit people's values. And like if there's an emotional moment, like either sit there or acknowledge it. Don't like rush past the emotion in clinical encounters. But then I think I do, since Paul got sick, sort of think about all of this stuff like more soulfully. I'm just like, this is very meaningful and soulful. And it's like an important part of people's lives. And I think that's sort of been really deepened for me.
Mhm. Any tips for talking to young children about when somebody they love very much is diagnosed with has a
Mm.
terminal diagnosis?
Yeah, I mean, this just seems like so incredibly hard. I mean, I think the main thing I would do is ask to talk to a child life specialist who can help you figure out. And that's like in hospitals or health systems, there's child life
Okay.
specialists who can
Okay.
help you figure out words to use. And then I also think like all the circles of people that support kids are so helpful. And obviously it's a big trauma, but having a like even one supportive adult who like really sees what they're going through and is someone they
Mm,
can talk to is like so ultimately protective against trauma. Um, I don't know the answer. That's so painful. I think that's like maybe as hard as it gets.
I think so too. Lucy, it's like it's always a pleasure anytime I get to talk to you. It's just like I love how you, of course, bring your brilliance to the table, but in that brilliance is woven in this soulfulness, and it's just beautiful.
Thank you
So
so much.
please keep coming back to our EOL Ask the Doctors, and just join us for any of our content on our site, and we appreciate you. Bye bye.